Now today
more
we'll
than
be seeing a very interesting
typical sine wave.
video.
GIT has
What we
been
can see on the monitor is we are continuously seeing this sine wave pattern. These are basically ECG leads which are simply showing no P wave, no QRS, no T wave, no any wave. It will simply show
GIT पानी के
a
अंश से आवाज है.
waves, C waves like pattern. This is very typical of sine wave pattern. Now we must know this sine wave pattern is very typical of hyperkalemia. And whenever the serum potassium level is more than 9, patient can any time have this type of sine wave. What is the meaning of this sine wave is that heart will not at all contract, and this is the condition where heart will not pump, so that the patient will simply die of hypoxemia because of the cardiac failure. So here the patient has to get cardioversion. It is very necessary, and at the same time, patient must get GI drip, which is the treatment for hyperkalemia. GI drip means we give around 25% of dextrose, and we mix around 8 to 10 units of human atropine or insulin, which is extremely important. We must know that normal serum potassium level is in between 3.5 to 5.5. Whenever it is in between 6 to 7, what we very commonly get is tall, tented, symmetrical, peaking T waves. Peaking, so the T waves will be taller, symmetrical. So if we can draw the midpoint, the both the ends or both the half will be almost symmetrical. This is a very typical feature of a symmetrical tall T waves of hyperkalemia. When serum potassium level is in between 7 to 8, the QRS will get widened and there will be loss of P wave. So if whenever we get that there is no P wave and the QRS is wide, we should always think of hyperkalemia, because after 8, patient may have ventricular tachycardia, ventricular fibrillation, or cardiac asystole at any point of time, and we can simply lose the patient will die. And more than 9, patient cannot have a sine wave pattern, which is the C waves like finding on ECG, which means the heart is not at all pumping and patient is about to die. And that particular time, we need cardioversion to revert the patient. Most of the time, if this type of sine wave or ventricular tachycardia, ventricular fibrillation occurs because of hyperkalemia, most of the time it is very difficult to survive the patient. So we must know these findings. Thank you.